Sorry, guys, a few more people just logging on there. So we'll just give them a couple of more minutes to get ready and we'll start then, okay? Okay, guys, how are we all doing? I know we've got a lot of people here from different parts of the world. So do you want to throw into the chat where we're all from, what your name is, what we all do, and what part of the world we're in? So where are we all? If you don't know where our clinic is, you're signing in from a different country. We're in sunny but cold Dublin. If everybody's outside, then it's not too bad, but the weather is a little bit schizophrenic in Ireland, as everybody else knows. We're still getting a couple of stragglers in. So yeah, grab a grab a beer, grab a glass of wine, and we'll just give these guys another 2 minutes, and then we'll start. Okay. Hi Sarah, hi Bernadette, both from Dublin. Neve, all the way from Cavan. How's things up in Cavan, Neve? Andrea, I've seen a lot of you this week, Andrea.
Yeah, I was just going to say, it doesn't look like Bellarmine.
It's definitely not Bellarmine.
No.
Okay, guys, you all ready to go?
Yeah.
Where else have we got? So I'm just gonna put everybody on mute now for the moment. And that one's it. That one's it. So who else left? Got them in. Okay, I'm gonna share my screen. Where are we going to share screen? And share. And there we go. Start from the beginning. All right, guys. So Resync Physiotherapy. I'm Dermot. I'm the clinical director at Resync Physiotherapy. This is set up, started off as Step Aside Physio in 2017, and then we rebranded to Resync Physio. Why Resync Physio is because we resync the body to get back into normal homeostasis, as we call it, to try and get everything to work back as a system again. As I said, I'm the clinical director. My background is I have a degree in biomedical science, of masters in physio, masters in sports medicine, along with kind of a couple of other small little courses that we've done in over the years. So I qualified in around 2009. And what we kind of found was that when I worked in different countries, I worked in the UK and I worked in New Zealand. And what we kind of found is that there was a missing link between everything, between doing physiotherapy, getting your massage, getting your dry needling, and it just wasn't clicking. Things were not getting better. And then I started to get a little bit more interested in strength and conditioning and biomechanics. And then that brought everything in together. And the basis of our clinic is to number one, get you out of pain as fast as possible, but number two, to strengthen you and build a little bit of resilience. The best way to build resilience is obviously resistance training. And first time when we kind of introduce people to it, they're like, oh my God, I'm not able to lift that weight. And you'd be very, very surprised under supervision what your body is capable of doing. And it's getting rid of that fear factor. Fear factor is what drives everybody. So, and a lot of people will have low back pain based on sorry, something else coming in there. A lot of people have low back pain based on previous perceptions. So think about different people when they start to, if they want to, certain people, if they want to leave their house, that might make them very anxious. That anxiety gives them physical symptoms, high blood pressure, breathing increases, they start to feel a little bit faint, and they start to actually physically shake because they're so scared of doing it. And the nervous system has a lot to play when it comes down to low back pain, which we'll go through over the course of this lecture. So basically we're done in Bellarmine Plaza. Our staff is Connor Tierney, who's an athletic therapist but has a master's in sports medicine. Sarah Brandon has a master's in physio, and Rachel is our practice manager, and she keeps us all in check. So what we're going to do is we're going to have a look at how to take care of our back, what kind of stretching we need to do, what kind of strengthening is the best one to do, what is core strength, and then, as we all know, in lockdown we've been succumbed to Joe Wicks and his HIIT classes, who's been my very best friend, because we are inundated with people doing Joe Wicks exercise classes and being in a jock. And this is just what happens because there's a lot of jumping around in it, and sometimes the body's just not able to tolerate that load. We'll have a little bit of look at running and a little bit of look at our sport as well. Can everybody hear me okay with this? If you can, just pop anything in the chat that you can.
Yeah, we can.
Everything's all good. Still people coming in there. Just trying to look at here what's happening in the chat. So if you're just new and you just joined us in there, just try and pop something into the chat there, what your name is and where you're from, and because we have a lot of overseas people coming in here as well. So low back pain. So we're going to cover all these spots in here, and hopefully get you guys to ask any questions that you have. If you have something that's coming up and it's on the top of your brain, pop it into the chat there. I'll scroll past it. I'll scroll down back on all your questions, and I'll try to get them as much as possible. And again, because you've joined us for the webinar and you signed up, we're offering everybody discounts for certain programs that we do, or to come into the clinic, or to see us online, and you'll be getting an email on that after this webinar. Okay, so let's continue on as we go. Let's pop this down here. So number one problem is lower back injuries. Now, when somebody gets a pain in their lower back, the automatic reaction is, oh no, I'm after fucking doing something, and I'm going to be, you hear of somebody down the road that's after having a worst case of back pain for the last number of years, and they're not able to walk, and she was bedbound for 3 or 4 weeks and she wasn't able to move. That is the 1% of cases. It does not happen. Everybody likes to hear about the bad cases, but then there's 99% of the other cases that are just simple low back pain, that it doesn't mean that there's damage. It just means that you're not moving correctly. And a lot of people, yes, we have access to a lot of the healthcare service in Ireland. And sometimes if we have health insurance, we have access to the top surgeons. But think about it this way. Do you want to go see a surgeon if you have a minor case of back pain? Yes, they're going to give you all the answers that you need to be. Yes, you're going to have an MRI. But going to an orthopedic surgeon is like getting an architect to build a wall. They guide everybody that builds houses. They don't generally build it themselves. And that's what we want to get through to people. And we want to try and not clog up our healthcare system with low back pain, and use some of the other therapists and some of the other practitioners, pharmacists, GPs, physios, and when to go back and start the training. So if you want to go to when you're going to go see a GP or when you're going to go see a physio, we want to kind of figure out, what do you want to get out of it when you go to see them? If you want medication, you want painkillers, go to a GP. If you want to understand the problem and get some exercise and some massage to try and fix it, then go to a physio. And that's the only question you should be asking yourselves. Is one more qualified to assess your injury than another? Yes, generally a physio is, because we deal with back pain day in, day out. Like we see 45 patients a week in our clinic, and then multiply that by 48 weeks of the year. And a good 55 to 60% of them is going to be low back pain, as opposed to a GP who are absolutely excellent at what they do, but they have a broad range of knowledge that they need to be able to be on top of in order to deal with everything that comes into your clinic. So when you're going to a GP or physio, figure out what you want, what type of treatment you want for your low back pain. Not one treatment is going to be better than another. It just depends on you knowing your body, and you go, right, I've had low back pain for the last number of years. I've tried the painkillers. It still comes back. Let's try something different. Then obviously the GP is not for you. Let's try physio. Do I need an MRI? MRIs are only needed if you have completed a substantial period of rehab. And that all the evidence is pointing towards strengthening. Yes, doing Pilates is good, and it will strengthen up your core. But what you have to understand with Pilates is if you sit at a desk all day long, yes, your core gets a little bit weak. But then you start to do your Pilates and you're in that crunched position again. You're strengthening in that position. So is that the right thing for you? Maybe, maybe not. It might help, but it might not solve the issue. You might get stronger in your core, but it might not solve that low back pain. So you have to consider, if you're standing up and you're walking around all day and your back is a little bit sore, or you're after post-pregnancy, or you feel that your core muscles have not worked as well as they should after you've had your child, then yes, Pilates is absolutely excellent. But if you're sitting down at a desk, might not be the right track to take. Now, so if you are going to go for an MRI, you generally have to have seen a physio for a couple of weeks before we start to kind of go, right, maybe something is going on here that we need to have a look at it. But they are only 5% of cases. And then you go in and you get your MRI, and then you get these results, and there's all these massive words coming out, and you're just looking like at the GP kind of going, I am screwed. You don't understand it that well. And then you have all this big jargon, and your GP has about 10 minutes to explain to you what's actually on the results. Now, if we have an MRI and you look at your back and you have all these degeneration, osteoarthritis, disc bulbs, prolapse disc, they're all relatively normal unless they match up to what we see clinically in the clinic. So what I means by that is that you come in and let's say your MRI says you have the worst back in the world, but then we put you on the bed, and next thing you start to assess that back, you start to assess your muscle strength, and we find one or two areas that kind of go, right, this is a little bit weaker, we need to strengthen that. Then we strengthen that area and your back feels better. I didn't just fix whatever was wrong with that MRI in that 10 or 20 minutes. It's basically comes down to a strength issue that we just need to strengthen the area, because everything you find in your back, degeneration, disc prolapses, osteoarthritis, it's all part of aging. It's like getting gray hairs and wrinkles. It's not as bad as it sounds. So be very, very careful when you look at your MRI. Yes, people might have disc bulges, and yes, they are there. And what we understood about disc bulges 10 years ago is completely different about what we understand about disc bulges now. We just find that we see them as an accidentally finding. They're absolutely nothing to be worried about unless we can match them up clinically, what we see when we assess you. So things to avoid when your lower back is sore, like obviously it's doing things in moderation. Your body likes to be challenged. So when you have low back pain, don't sit too long, don't stand too long, don't walk too long, and don't do exercise for too long. Now that's very easy for me to say, but what I mean is if you're sitting down all day and you have a sore back and your back is sore and you're sitting, you probably need to get up and move around. Yes, it's going to be disruptive in your lifestyle. Yes, some people can't do that because their just job does not allow it. And then when I say, oh, don't bend over when your back is sore, when you have little young kids like that, it's going to be very, very difficult to do it. But what you need to incorporate into your day is, yes, get through the day, but spend some time to try and work on that back, do some general exercises and do some movements. Things to do when your back hurts is find out what your back likes. Some of it likes a little bit of core strengthening. Some of it likes stretching out your glutes and your hamstrings and your quads. And then some of it likes just gentle moving or walking. Find something that works for you and then use that as a strategy to manage your low back pain. If it goes away, happy days. If it doesn't, go see a professional. Do you need surgery? 9 times out of 10, you're not going to need surgery at all. Very, very rarely will they do it. Like I have a guy in here, they will generally do at least 2 injections and 1 or 2 rounds of physiotherapy before they'll even consider surgery. And if you have a consultant that's going in there and you only have back pain for maybe a couple of weeks and he's going, look, we need to open you up, I'll be getting a second opinion. Like what we found with some of the studies is that 2 years after having surgery for low back pain, or 2 years since the onset of low back pain, if you have surgery, you're actually going to be the same if you have surgery or you don't have surgery, because it just takes that little bit of time for your body to get right. How to take care of your back? General movement, sitting in positions, sustained positions. Your body likes to be moved, so get up and move around. And it's like people kind of ask, it's good, well, I don't really know what to do. It's as simple as just making a start and figure out what you like. And that, if that's going on to YouTube and finding out some stretches for your lower back, you can find a 10 or a 15-minute program that you can just follow for your lower back. Just follow that on YouTube. That's the simplest thing you can do. If you want to find a lower, if you want to find a Pilates class, you can find that online. You can find that on Instagram or Facebook. There's plenty of them there. There's free information out there. And if you're doing exercise like that, it's not going to hurt you, but you just realize that you just have to realize when you feel like your body's had enough. And what we have a rule of thumb, when you're in pain, all you want to do is a little bit of sustained exercise. That's about a 4 or 5 out of 10 in difficulty level. So a 10 out of 10 is you absolutely sprinting 100% as far as you, or as hard as you can. And then a 5 is just 50% of that. And just go at that for 10 or 20 minutes. And it takes, then the next session you might do a 6, and the next session you might do a 7. So it just takes that little bit of time to get used to it. A little bit of stretching. Again, follow a lot of YouTube. I'll give you some exercise ideas, some strengthening exercises, simple bridges and simple movement. People are afraid to move when they are in pain. And that's normal because you're sore. But if you don't move, it's generally not going to go better. Like rest is not rehab. You have to do something to help your back. Running. A lot of people start to get low back pain when they run for long distances. If you're running for long distance, your back is starting to get sore. Try to run for short distances, but run faster, and then see how that goes. Your HIIT classes, if you have a HIIT class and you have low back pain and you're jumping around the place and you're jumping up in boxes and they're kind of doing all these kind of running techniques that Joe Wicks likes to do, and they're jumping from side to side, you're probably going to make shit of yourself. So just try and calm it down a little bit. Rather than doing HIIT classes, do a sustained exercise program. When to return to exercise, there's no harm in picking. The problem getting back into exercise is the level of exercise that you choose to get back into. If your back is free of pain for 2 or 3 days, you don't go out and play a rugby match. You have to guide yourself back into it. Start off with walking, start off with faster walking, start off with intermittent intervals with faster walking and slow walking. Then you do the same with running. Then you test it. If you go back on the pitch, try multi-directional running. And there's a lot of these things that you can work with. So the spine injuries that you kind of see on your MRI, and here's the kind of just a normal little picture. I see up here at the top, there's that normal little picture there of your disc. Then it'll lose a little bit of disc height and it'll have a little bit of a tear in it. That's absolutely normal. Bulging disc, when it pops out the back here. Now what you have is this nerve that comes down through here, down through the side. And what happens is the disc hits on that. A herniated disc is when it's actually an awful lot bigger and it's taking up more of that spinal canal space. Thinning discs, while it is common, it's generally normal when it comes down to it. And then sometimes you might see a little bit of degeneration in that spine. Let's do the chats. What have we got here? Sorry, just checking on the chats here. So your lower back starts to ache. Even Hodge, throughout today, I'm standing in normal desk with the keyboard and box and monitor. Have to keep moving. Yeah, so Heyman, yeah, that's what we see an awful lot of the time. If you're standing at a desk, we like to see people that transfer from. Sorry, Eamon said if people can't read this. I'm standing at my normal desk with keyboard on a box and a monitor. So there's your problem very at the start. Your keyboard's on a box and your monitor's raised a little bit. I have to keep moving around bits. Generally, what we find with those people is they'll start to flare up. The rib cage will lift up because you're standing in that position for so long. My advice to you with that is to mix between sitting and standing, and get a proper desk. A lot of people are working from home these days, and you need to be able to tolerate that load when you're at home, standing at a desk. But you also need to be able to transfer between sitting and standing, and then you need to be able to have time. You can't stand all day. It's just gonna wreck you. So keep if you're getting sore when you're standing, generally you might have good strength, but those smaller intrinsic muscles don't have the endurance to hold you up in that position all day. And you'll transfer your weight from one hip to the other hip, and then you might draw that knee in a little. You might put more weight on that hip, which then that hip kicks out, and then that muscle starts to get a little bit weaker. So there's a lot of different things we can look at with that. And then you're stressed out of your nines as well, and then you stop breathing and you stop expanding through that rib cage, and the rib cage gets very, very tight. And all of that's going to affect how that spine moves. Your spine wants to move. It's a structure that's robust. It's strong. It doesn't get injured very, very easily. And that's why when we see an MRI and some people see all this shit on it and they're kind of going, Jesus Christ, that's it, I'm screwed, I can't move. And they wrap themselves in a bubble and then they start to decondition their muscles. And you see the vicious circle that people get into. Okay. So these are lumbar spine injuries. Spinal stenosis means that like there's a little bit of narrowing where the nerve comes out. And then your arthritis is just a little bit of inflammation in the joint, but that is normal. I have an MRI on my back. There's a little bit of arthritis in it. There's a couple of disc bulges. Joint facet, I'm missing a little bit of a typo there, and it was never very good. And most people that know me, I know that I am illiterate. So I suppose it spelt it right even. So joint facet, joint degeneration is these facet joints here on the side that tend to slide across each other. So what actually happens is, I'll just bring this up here. So the two joints are sitting at an angle like that, and one slides up and one slides down. And what happens is that the space between those joints starts to go down, and then it actually makes it a little bit harder to move and your spine starts to stiffen up. Spondylosis is when that lower part of the spine, you have that big arch in your lower back, that big curve, and there seems to be a narrowing at the bottom part of the spine. Sciatica is thrown around so much, and it's just one of those things that the GPs like to look at and just kind of go, oh yeah, you have a pain going down your leg, you have sciatica, without giving a ball's notions of what that actually means. Now, sciatica seems to be, or is known for a referral of pain down the leg, but it doesn't normally mean that it's coming from the sciatic nerve that comes from the base of your back. There's plenty of different structures like muscles and tendons that can refer down your leg. Rule of thumb, if you take anything away from today, rule of thumb, if the pain is going past your knee, it's normally related to your lower back. If the pain is only it stays above your knee, it's more than likely hip or groin or pelvis. So think about it that way. Okay. Spondylolisthesis is when that curve in the back actually gets a lot worse and the joint starts to slip down on the top one. So if you see that picture over on the right hand side, imagine that last little segment there slipping forward, and we don't want that to happen. Okay. Great info there, thanks Adam. Next page. Where we got to? Risk factors, age. So generally, if you have a bout of low back pain when you're younger, you can have a little bit of a risk to it happening later on in life. And it's just because I think, and this is my own little brain fart of an opinion, is that because we're conditioned to be fearful of low back pain, and one person gets about a bad bout of back pain, they're always saying, oh, I have to protect my back for the rest of my life. That is not the case. It's just the case you have to protect your back for the rest of your life because you didn't fix it in the fucking first place. And that's the problem. Everybody needs to fix that back when it happens. Yes, it's okay getting dry needling, a little bit of a massage, but you need to strengthen up that area. It's like if I've done so much damage to my ankle, but each time I do damage to it, I have to strengthen it back up. Rest is not rehab. You need to be able to get that back strong again. Some people might need to strengthen their hips. Some people need to strengthen their legs. Some people might have to strengthen the lower back muscles because they don't have the same endurance as they had before. And then some people need to strengthen their strengthen their core. And then some people need a little bit mobility. So it's all personalized to what we do here. Your fitness level, your back is more common among people who are not physically fit, which meaning that if you are sitting down an awful long time, but you are strong, it doesn't mean that those muscles are conditioned enough to put through the exercise that you're doing. So if you sit down for 8 hours a day and then you get up and you try to play a soccer match, you're going to end up with troubles eating your hips or your knees because your body's just not warmed up for that, and it's not used to contending with that amount of load in such a short period. Weight gain can put pressure on the discs again. Obviously, this is a little bit more of a difficult case because when you add weight, then your system is a little bit more under pressure. So it's finding that right level of exercise that works for you and building it up slowly from then. Genetic ankylosing spondylitis. That's a little bit more difficult, and it's an inflammatory disorder that attacks the back and it makes you quite more stiff in the morning. Can be very, very complex, but those type of people need to really hone in on what their back likes. Job related, sedentary jobs, obviously we know that that's not great. Pushing and pulling and manual work, we have a lot of people that kind of come in if they're lifting up heavy things like manhole covers, or on the building site, they're physically strong men, but what's actually after happening is they're just after tiring out, or they don't move as well as they should. Mental health can play into it as well. If you're not feeling the best and you don't move as well, you start to have this posture where you're kind of slouched a little bit more because things are just that little bit more shit for you. It's not easy, so we generally have to find something and find a balance that's able to get them to do some exercise to release some endorphins, so they're actually able to kind of go, all right, things aren't nothing so bad. And once you release those endorphins and you balance out your hormone levels with the exercise, then your mood starts to lift and that low back pain starts to go away, because number one, you're doing exercise. Number two, you're starting to get those endorphins. Number three, those dopamine and serotonin levels are starting to rise, which is kind of like your happy hormones that are released after exercise. Backpacks overloaded in children. Yeah, going into school, we generally see it in September or October. There's spike in training load for kids because they're doing an awful lot more than what they would have done during the summer. They're training on 3 or 4 different teams. They're carrying a big backpack to work. Then they're sitting down all day. Some of the coaches may not be getting them to stretch as much as they should do, or not targeting the right muscles. For instance, females, especially young girls, tend to be more quad dominant, which means they use the muscles in the front of their legs more so than use the muscles at the back. But yet coaches will put them through a squat program, which will be a lot of squats in the training, and that's inherently a quad dominant exercise, which increases that the strength in the quads when we want to actually increase the strength in the glutes and the hamstrings. And these are some strategies that we'll use and we'll see quite often in the clinic. Psychological factors, mood variability and depression. Not easy to deal with, but in general, exercise can help with that. It's just finding the right level that it works for you. Then this little photograph here on the right hand side. Did you know your MRI can be misleading? If you take people without back pain and put them through a CT scan or an MRI, you'd be surprising with the results. And this is what I was mentioning back earlier on. Disc degeneration as high as 80% in 50-year-olds. And bulging disc, 60% of 50-year-olds are going to have it. What they did with that was they basically took 1,000 people and they MRI people with back pain and MRI people without low back pain. And I think they weren't even looking for variations in the MRI scans. But what they found was that there was the exact same structural abnormalities in their lower back for people that had back pain and people that hadn't low back pain. So then we kind of need to consider that, right, what we're seeing on the MRI, that doesn't necessarily mean that that's what's causing your pain. Just going to go back a couple of questions after coming in here. Increase in numbness extending into the foot, especially on walking, since most recent increase in back pain. Okay, so this is special here, right? This is to Bernadette. The pain going down into your foot, right? More than likely, that's probably coming from a nerve in your back. If you're, depending on what age you are, if you're female and you've had a couple of kids and that core muscle isn't working as well as what it should do, then your low back pain is going to go into this kind of this arch. So your back is going to arch in that position. That's going to squash it's going to reduce the area that the nerves had to come out in your back, which may be referring pain down into your foot. How do we resolve that? Number one, we need to condition the muscle to tolerate the level of walking that you're doing. And we need to stabilize more the muscles at the front of your stomach. And what we do with there is just basically strengthen and then give you a walking program that's not going to annoy the back. So if you're having pain go down your leg after 5 minutes, you need to probably stop walking and you need to start doing some exercise to open up that gap at the lower part of the back to lengthen those tissues and strengthen at the front. If it's like 30 or 40 minutes into it that it's starting to get really, really sore, then you probably need to pull back your exercise a little bit more. Do 25 minutes fast walking, give yourself a little bit of break, do another 25 minutes fast walking, and then you're still getting your 50 minutes in there, but you're just doing it at a different pace. Been suffering from back pain for months, done a lot of strengthening, stretching, and yoga, but no improvement. Should I give it a rest? Camilla, depends on the strengthening. It depends on what you've been doing. Ultimately, what we would be looking at in the gym is we'd be loading you up with 10 or 15 kg and seeing what your body can tolerate. There's no better way to figure out where your weakness is in your body is you put it under load. And putting it under load for 1 or 2 reps, 3 reps is not going to cause your pain to get worse. It's going to show us where your weaknesses are. If you go into an exercise class and you're doing 50 or 60 of these, then that's when you're going to go end up in a jock. So give us Camilla, give us a little bit more information there, and I'll touch on that again in a little bit. So next slide. So you wake up and you're in a jock, and then you look like this, lads. So what do you do now? Well, we have to go and make a decision where we're going to go see. Going to go see a GP, as I mentioned before. You can get your MRI if you want to. Generally, they won't give it for maybe 6 to 8 weeks afterwards. You can get some medication, some painkillers, some ice, some reassurance. What can physios do? We are the experts in pain and injury. This is what we do all day, every day. GPs, as I said before, have to have a broad knowledge and they're excellent at what they do. But when it comes back down to back pain and general pain, we are the experts. In about 3% of cases, it could be something a little bit more sinister, but 95% of cases or 97% of cases, you're just go see a physio and go see a good one. So do you need an MRI? As I said, 95% of cases don't need an MRI. And what if you're the 5%? Well, if you're the 5%, sometimes this happens. So what you're going to feel is like, right, physio isn't working, the pain isn't getting anywhere better, you're still severely limited. Everything that you do is making it worse, not keeping it the same. And then if you're making it worse and then you're actually being flared up for a couple of days afterwards, then we start to kind of go, right, this isn't for physio. This is where we need to refer on to the specialists. Painkillers and advice and physios, as I said, you probably need 8 weeks of it to before the surgeon will consider doing surgery. And then again, think about it this way. If you had an MRI and you didn't understand it before you had this webinar and you looked at all these results, you kind of go, oh, this is screwed, this is screwed, this is screwed. And you're always fearful of that happening. And you're always fearful of, guys, I need to protect my back because I've seen a scan that says that this is wrong with it. But you don't really understand the scan until you actually understand what that means in the relation of our clinical assessment. So it's how we bring everything together. So here is on the right-hand side, this is my MRI for March 2019 when I hurt my back. So basically right side of pain going down the leg. And what we see, again, I was 34 with this facet joint degeneration at 2 levels. And then there's a broad disc-based protrusion, mildly compressing the right S1 transverse nerve root, mild facet joint degeneration. That's completely normal. Now, I did this in a gym. I injured it and I had pain going down the right leg. And once I kind of figured out that, right, I need to protect this for a little bit and these are the exercises I need to do, pain went away. I was back in the gym within about 3 weeks. But it took me a couple of months to try and get to that because I tried a couple of rehab programs that weren't really working for me. The pain was still coming back, but I also was driving 50,000 miles a year that year. And that's what really set it off. I was doing a lot of driving between clinics, and it was just around the time that I went full time at Step-Aside Physio, or Racing Physio, as it's called now. And that's when it started to give me shit. I got some steroids. I didn't go for the injection. The steroids helped, and I did some exercise, and I built up gradually. And I was back on a football pitch by April, May, and everything was happy. Okay, so don't freak out when you see your MRI, especially when you get older. There's going to be an awful lot more things on it. And if you have a good MRI, that's even better. It means you're doing all the right things. So don't be worried. Okay. So there's my one there. And all I would say to people there is it's grand. So like this is your spine. So you're looking on the right-hand side, you'll see the discs there. Now that looks completely different to the other little picture that we had up there the last day, isn't it? Like these pictures that they put up on the internet make things so simple, but everything is interconnected in it. Like, so see that white little river that's running down there at the back of the spine? That's your spinal canal. Then at the bottom, you have that little disc bulge that's circled in the blue. And then that's encroaching into that spinal canal, which was giving me the pain down. And then on the other, to the right of that, then you'll start to see those facet joints. They're a little bit squiggly there, but then you have the muscle sitting over them. And you see those little lines that are going down towards the muscle there. Oh, can I draw on this? Oh, wait. Oh, I can draw on this. There we go. I didn't know we could draw on this. I'm only getting used to Zoom, guys. So there, what we can do is we have a look at that. See, that's the muscle that's attaching onto the bone. So everything works as one unit together. And then what else we got here? Oh, that's just a big lump of fat because I had a little bit of weight gain about then. All right. So yeah, that's how the things add in together. So don't be alarmed when you see these sort of things. Okay. All right. So how do I get these things off? Oh no. Is that still on everybody's the little drawing there? Is that still on it? Oh, eraser. There we go. There we go. Now that's better. I'm learning loads tonight. Okay. So now this is where we get into a little bit more nitty-gritty stuff. Okay. So what is this thing? See this thing on the left here? So this thing there. All right. That it looks like a seesaw. All right. Now our bodies are made up of levers. And what I mean by levers is that they will use a fulcrum here. If you put a child on this end here and I push down here, it's a lot easy to lift that child up because you have this pivot point in the center of it. Now, what would happen if I moved this force down a little bit closer to the fulcrum? It'll be harder to that pivot point. It'll be harder to lift up that load, that L on the other end of it. So what we're going to be able to do here is if we force down here, easy. If we push down here, hard. If we try lift from here, you're pissing into the wind. It's really, really hard. Now, what happens with our lower backs? Now imagine this is your foot here. This is your hip. And this is your spine as you're bending down. Now, what we see here is that our glutes are up around our hip, our hamstrings are here, our calf is here. They act as a pulley to lift yourself back up. Now, that's the equivalent of applying force down at the end of that seesaw. Makes it nice and easy. If you go to use your back muscles, which are in front of that pivot point, it's 10 times harder to lift yourself back up. So what we do, it's not the way, or it's not you bending down and coming back up that's causing your pain in your back. It's the muscle strategies that you're using to actually complete the movement. So you need to be able to recruit your glutes and your hamstrings to be able to do it. And that's what we do in the clinic. We start to strengthen all those areas that make things a little bit different. So it's how our body uses force. And that's the key to getting people better. Figuring out what the science is behind it. Okay. Let's just have a look at the chat there. Pain and numbness down the left leg and shin. Can't sit down without pain. And Camilla been suffering back pain. That's the same there. Pain and numbness going down the leg. Again, if it's going down the leg, is it coming from your back? This is a question that Martin had. Is it coming down your back or is it coming from a muscle? It depends how long you can sit down for. Big tip for guys who have pain sitting down. If you're sitting into a deep, deep couch where your knees are above your hip, that's bad. Pop a couple of cushions underneath that hip so your hip is above your knee and you're not bent down into it. That's going to cause an awful lot more pressure on your back. If you sit up a little bit higher, it makes things a little bit easier. Pain and numbness going down the leg can be easily fixed if you can try and get some strengthening exercises to support that spine again. But ultimately, we need to take out the aggravating factors, which is sitting down, or get you a different chair to sit on. And once we get that, then you can stop annoying it, and it'll get a little bit better. So let's get this off again. Eraser. There we go. There we go. So things that are driving the back is sore. So again, as I mentioned this before, I want to avoid doing too much. Now, Mary comes into me with back pain. Mary is 50 years old. Mary loves spending time in the garden. Mary comes in. I make her a little bit better. Mary thinks she is absolutely fixed. Goes out and spends 5 hours in the garden. Hasn't spent 5 hours in the garden in about 6 fucking months. Mary's going to be in a jock again. So you have to put things into perspective. When you come in and do your exercises, it doesn't mean you're fixed. It means that we've got you out of pain. The pain will come back because the muscles aren't conditioned enough to deal with what you wanted to put it through, which is being in the garden for a couple of hours. That makes sense? Everybody in the chat still with me now, or do we need to have a little bit of a break to come back and see what's happening? What do we think? Pop everything into the chat there if everybody's still following things. Where is chat's going to? Still all good? What have we got? Oh, good to keep going. Everybody got a beer and a wine. Perfect. Doing too much. So you're in pain for a reason. Think about it this way. Everybody do this now. Grab your earlobe. There we go. I can see you all doing it. Now squeeze it as hard as you can until you have pain. Okay? Now take your hand away. Is there any damage? No. There's no damage because you just had a little bit of pain. So pain is just an alarm system. It just tells you something is happening. Now, in the absence of a big injury where you fall over and hurt yourself and you start to develop pain, it's unlikely that something is injured. You're just not moving right. A joint is tightened up. A muscle isn't working as well as it should. A muscle is fatigued from what you've done. So don't be alarmed when you're in pain. And if you have injured something, you will know at the exact point that happened, because it will be like you fell over, or you went to run across the road and you felt a pop in your calf, or you're running on the pitch and you felt the muscle go. If you start to tighten up afterwards, it's generally down that you've done a little bit too much and your body's trying to protect itself. Do things a little bit slower. I was a demon for just getting up and flying through the day and just getting up and getting on with things and doing things as fast as I could to try and cram as much as I could into the day. That ultimately was my downfall. I just needed to slow things down a little bit more when it hurt my back. So if you have a busy day, just allow yourself that 10 or 15 minutes extra to try and get things done in the morning. Simple things is getting dressed. It's going to take a little bit of time. Excuse me. If you're in having a shower and starting to get a little bit sore, it's going to take you longer to get dressed. It's going to take you longer to make your breakfast. It's going to take you longer to get, well, I was going to say take you longer to get into the car to drive to work, but none of us are doing that at the moment. But it's just going to make things a little bit easier for you. When you're sore, don't do nothing. Get up and move about. And as I said before, stick on a small little mobility video on our Facebook group page. We have loads of different mobility exercises that you can try, and just do them very, very gentle, very, very easy. Stick into that 50%, that 5 out of 10 effort level, and do that for about 15 or 20 minutes. And you'll feel yourself beginning to loosen up, and then realize where you're tight. So does my sides feel tight? Does my hip feel tight? Does my back feel tight? Does my upper back feel tight? Get to know your own body, and that's key to helping people. And again, think about it. Think about your car. If you have a rattle in your car, you're not going to go on a 4-hour drive down to Kerry or down to wherever you're going, because it's not going to help. It's not going to make it better. It's not just going to go away. So you need to pay attention to it. So you bring it to mechanic. Same thing with your body, folks. Just get it sorted. It's not going to go away. How many times have you heard of somebody that kind of goes, oh, I had back pain one day, it's gone away the next day, and it never came back? Very, very, it does happen, but very, very rarely. So play the numbers, folks. Play the numbers. Okay. What we got next? So things to do when your back hurts. Breathing is a massive one. Now, everybody doesn't understand the benefit of breathing. When you're stressed out, if somebody's having an asthma attack, what do you try and do? You try and slow down their breaths. If you slow down their breathing, what happens is what we call our parasympathetic nervous system. Our sympathetic nervous system is like our fight or flight. It's what we had in 100,000 years ago when a tiger was chasing us. Our sympathetic nervous system spiked up, adrenaline rushed to your body to get you out of danger. Now what's happening these days is we're not having that spike in this sympathetic nervous system. We're having this gradual increase of stress, where it's a slow killer. Now, you remember those Chinese signs of yin and yang, where it goes around in a circle, black on one side, white on the other side of it? That's our body in balance. If you have too much of that fight or flight, that sympathetic nervous system, that stress, and not enough relaxation, you're going to be all tense, and all those muscles are going to be in a protective state, and their adrenaline is going to be pumping around. You're firing coffee and sweets into you to try and get through the day, and your kid's wrecking your head, and there's nothing you can do about it. So all you have to do is take 10 minutes to yourself and try and do some deep breathing. There is guided breathing and meditation that's online. What does the breathing do? It helps you ground yourself. It helps you take slower breaths and just try and relax. You always see it during the day when you're sitting at a desk, is every now and again when you have a stressful day, you start to go, oh, Jesus, fucking hard. And then you start to try and relax into those positions. So you've got to understand what the breathing is going to help you. Again, as I said, trying to relax. If it's reading a book gets you to relax and takes your mind off things, then do that. If it's getting out for a walk, if you're able to, and your pain in your back isn't getting at you, then fine. If it's reading a book, if it's taking a bath, if it's getting out for a walk, if it's baking, if it's cooking, do something to take your mind off what is causing you stress. Yoga is very, very good because it's slow movements into positions that you help you breathe. But just remember, folks, if you're very, very mobile and you're doing yoga, you don't need to stretch more to try and get rid of your pain. You need to strengthen and be strong in the areas that are causing you trouble. I had a girl in there today who was a yoga instructor, and she was doing exercise classes online. You think she would be very, very strong, but she was having an awful bother with her hip and she couldn't run. And basically, she was just weak in one area that we needed to strengthen into it. But it had been going on so long, been going on about years, and then it flared up over the last 3 or 4 months that she didn't come and see me about it. It's going to take me about 4 to 5 weeks to get that right. Whereas she tackled it at the very start, generally probably would have took about 1 or 2 weeks to solve before it got any way worse. Okay. A little bit of light stretching, a little bit of light walking, mobility. Check out our Facebook group. As I said before, there's lots of different exercises on there. It's Rethink Physiotherapy, free injury advice and tips. And you can just join into that, and we post content on that daily. So do I need surgery? No, more than likely, as I touched on this before, you're not going to need any surgery. So this is the picture on the right. There's a guy come into me, and then he's wearing the same clothes. And that's basically a couple of about half an hour later. And all I did with him was try to activate one part of his hip to make the opposite side less restrictive. Little bit of breathing, little bit of movement, and we can correct it back into this position. Now, his problem wasn't the fact that he was weak on that side, but he had a sedentary job, and then he had a newborn as well. So it was making things difficult for him because he was trying to help his back, but just life took over. So what we have is we start to give you management strategies to try and incorporate these things into your day. You do it all the time in your work day. You try to isolate different times to do different tasks. All you have to do is incorporate this into your day. So you don't need surgery. What the protocol is take your medication. If you're really bad, take the medication. If you don't like taking medication, think of them like an antibiotic. The antibiotic helps you get over an infection. The medication is going to help dampen down the sensitivity of your nervous system that's telling you to protect. That's all it's doing. It's not going to mask the pain that bad. If you've done something seriously wrong, number one, you would have known at the time that you did it. And number two, the painkillers won't do shit. So take the medication, let it settle down, go into physio, we'll educate you on what you've done wrong, try and get you moving, and try and get you a little bit stronger. How to take care of your back, move yourself in many ways. Right. So a lot of people kind of go, right, well, I sit up quite tall in the chair when I'm at work, but then you're just really, really good at sitting up tall and you're shit at slouching. And what we need to find is a balance between that. Your spine likes to bend forward and backwards. So what we need to be able to do is, yes, you need to be able to sit up, but you also need to be able to round it. It's having that control and that strength to be able to do that, which is what you need. It's not about being strong in one area. But think about it this way. If you're an office worker and you go, oh, well, I do exercise all the time. And this is generally what happens when it comes into the clinic. He's like, oh, I'm an office worker, I have a back pain. Yeah, Jesus, it's been really getting at me, very, very sore in the morning. So after exercise, I was like, all right, and we go through a couple of symptoms. How far is it going down? Where is it in your back? Let's have a look at your movements. And then we kind of go, all right, so you mentioned you do exercise. So what do you do? Oh, I cycle. All right, okay. So how far do you cycle? Oh, well, I do 2 hours into work. This is back when we were able to cycle into work. We do 2 hours into work and I do 2 hours home. All right, so you cycle 2 hours into work. Yeah. Then you sit down for 8 hours and then you cycle 2 hours home. All right, so you're sitting doing exercise. You're sitting at work and then you're sitting cycling, doing exercise on the way home. And he did that for 5 days a week. Do any stretching? Nah, don't believe in stretching. So what does that say to me there? Everything is in sitting and nothing is into extension. And all he's doing is overworking his quads and then keeping his quads quite tight as he sits down and when he cycles. So what happens with the quads? It pulls on the pelvis pulls on the back. You have back pain, that's the symptom, but the problem's coming from your legs and the exercise routine that you have. So stop sitting up tall and learn to sit up and slouch back into it. Now, A lot of people will sit away from the chair when they're at the desk. Now, hold on, just try and move this here a little bit. They'll sit up, they'll sit away from the chair, slouch down into it. The back of the chair is designed to take your back. Pull yourself into the desk and get your elbows on the desk so your shoulders are resting. Okay, I'm going to turn this down a little bit. I'm pulled right into that desk there, and my shoulders are just resting down in that position, and that's the best way to sit in there. That's a little bit uncomfortable. Move every couple of minutes. Yes, sit up for a couple of minutes, then sit down for a couple of minutes, and that might be a strategy to help you get through the day. Okay. Light exercise regularly. Stretch out the hips. They're going to be tight from sitting. Stretch out the upper back. They're going to be tight from sitting. I'll go through some of these exercises in a little bit. And strengthening. Don't do squats, because 9 times out of 10, you don't need to strengthen your glutes. You don't need to strengthen your quads. It's going to be your glutes, your hamstrings, and your core. Your quads are already strong and tight from number 1, walking and cycling. So you don't need to strengthen them any further. And a good tip for runners here, pay attention to this, runners. If you're running really, really slowly, or running at like 4.5 minutes, 5 minutes, 5:30 a kilometer, the main muscles you are using are your quads and one muscle in your calf called your soleus. If you're running faster and sprinting and doing your 100 meters and 200 meters, you're using your glutes, your hamstrings, and your core. Now, again, I'm going to revert back to this again. You're sitting down at a desk. Your quads are tight because you're sitting all day. Then you go up and you run slowly. Your quads are working, doing all the work, and they're tightening up again. It's better than doing cycling, but again, you need to mix and match it. So for every short run you do, or for every slow run that you do a medium one and then do a really fast one. So interval training. And they are the key tips that we kind of get, the strategies to try and help people work as much as they can. Okay. All right. So what we do in the clinic is we try to get your body back in sync. We listen to you, assess you, we get some hands-on treatment. The main thing is we strengthen and restore your normal movement patterns. So then what we try to do at the very, very end of it is try and build that resilience so it doesn't come back. And that's the key thing of it. It's the strengthening aspect that makes our programs work so well. So you want to vary your exercise. Your body likes to be challenged. So vary the movement that you're doing. If you're doing the same exercises over and again, over and over and over, you need to change it up. And if it's always bending forward, standing up, bending forward, standing up, try add in some lateral movements into it. And these are kind of things that will help your body and help your nervous system start to be challenged in a different way. Body hates to get used to things. And what we see with a lot of people come into as well is that, oh yeah, I'll go out and run 5K and they'll do it 4 days a week. They're doing the same thing over and over again. So their body gets so efficient at doing those things that it's not a challenge for them anymore. So you need to challenge different things. Pick the right level of intensity of your exercises. Again, that golden rule, that 5 out of 10 rule or 6 out of 10 rule, that's a nice intensity to stick at. And then if you go with that for 10 minutes, have a rest for 2 minutes and then do that 3 or 4 times. And then work, finally, if you're in the gym, you got to work on your single leg strength. It's great being able to squat and be able to stand up, or being able to squat down to a box and stand up. But if you're not able to do it on a single leg, it makes it a little bit different. If you have low back pain, stay away from your squats. And that's with the barbell on your back or your goblet, or you're kind of holding a weight in the front. And that's what Joe Wicks likes to do in those positions. What you can do is change that for a bridge. So lie on your butt, lie on your back, bend your 2 knees up and lift your butt up in the air like Connor's doing here in the photo. Okay. So what about your core strength? Your core strength is one part of a system. So like imagine this is your core cylinder. At the top, you have a diaphragm. Center, you have your abs. The bottom, you have your pelvic floor. And then around it on the sides are your transabs. Now, these are all different muscles that work as part of one system to keep you stable. Your core system is designed, it's like the chassis of a car. It's designed to give a stable base in order for your legs to move or your arms to push. If that stable base is not strong, you're going to compensate in your hips or in your legs or in your back. Something else is going to take the load. As you're walking, your foot hits the ground. If your foot is not strong enough, it'll distribute that load of your body weight up the leg unevenly, and you might get hip pain or you might get knee pain. Some people might get back pain, depending on what their strategy, what muscles they use to move. And that's what I'll keep on referring back to that. It's always that strategy that they use to move. Some people use their calves more, some people use their quads more, some people use their glutes or the back more. And that's what we try to figure out. If you're doing your core exercises and doing your planks and doing your Pilates, and all you're doing is holding your breath, that's not using your core. That's just not having control of it. You need to be able to breathe as you do some of these exercises. And as I said, it's how these systems interact with each other. Your hip's not strong enough, your back takes the load. Your front of your core is not strong enough, your back takes the load. Some people, if your knees aren't strong enough, your hip will take the load and your back will be absolutely fine. And it just varies from person to person. Okay. But get advice from an expert. Ensure you're getting the proper technique, especially if you're post-pregnancy. Post-pregnancy, think of it this way. You've spent the last 6 months carrying your child. You're not moving as fast. Everything's moving a little bit slower. You may or may not have been doing some exercise prior to giving birth. Those muscles are just not conditioned enough to deal with you going back into a high intensity exercise. So think about it that way. It's not about how strong it is about how strong you are for what you're able to do, but it's about how conditioned those muscles are for how long you're going to do that activity for. So if it's walking, you might be able to walk 200 yards, 200 meters, kilometer, 2 kilometers. You're strong enough to do that. But your muscles are not conditioned enough to walk 3K, because that's when you start to get sore. So it's all about conditioning and finding the muscles to correct them into the right pattern. Okay, so a little bit more what we're doing. If you're looking to condition for stuff, we've started a Pilates and lower limb strengthening course. Now you're going to receive an email about this, and I can actually pop a link into the chat now just at the end. And what it is, it's basically 6 sessions of exercise that you follow weekly. Sarah's guiding you through it. There's over 50 exercises in it. This is generally going to retail for about 50, 55 euro, but you're getting a discount on it today. It's an option if you're unable to come into the gym. We've designed this program to try and focus on lower limb strength, but also core strength, and stay away from those squats, and try and get everything to work better together in a guided fashion. And Sarah will bring you through each exercise that you need to do, and then you will get a PDF which has all the exercises that you can print out on to follow on a daily basis. And it's progressive, so you'll have 6 different sessions in it. You do one session, you do it 2 to 3 times a week, and then you can progress on to the next session. And each exercises are different, so it establishes different movement patterns, and it challenges your system in a different way to help you build strength in a safe manner. So what I'll do is I'll pop a link to this in the chat, and I'm just going to take a break now for 5 minutes. So if everybody wants to go grab a glass of water or grab a tea, and I'll come back in, and we'll finish off the rest of the program. So take a quick break there, guys, and I'll get the second half of this set up. Okay. How are we doing, folks? Just waiting for everybody to come back into, excuse me, everybody to come back into to the room. We'll get started on this this second part of it. Okay. How are we all doing? Are we enjoying it so far? Is everybody we are still alive, says Andrea, yeah. Has anybody any questions that they want to ask or they want to share any stories with them? So I always kind of do this with one webinar. I get somebody online to actually speak about their low back pain experience. And then what we'll do is we'll have a bit of a chat about it just to see where we can kind of go and what works best for you. So pop into the chat there if anybody wants to come on and just have a quick 5-minute chat about what's been happening with them. And it might give some insight to the other people that are doing the webinar. Because the whole idea of this webinar, look, there's so much bullshit and so much misinformation that's out there. And the people telling you to do this, and everybody's a fucking guru at this point in something. And all we want to do is just get the science out there. Like, the science works. The science has got us through all this COVID crap. And it's about being tested with, being scrutinized, being tested by the experts in the industry. Now, I'm around a long time, and you see all these fads that go through, and everybody says that this is the best thing for back pain. Nothing is the best thing for back pain other than movement and strengthening. If you say, oh, this is the best exercise or that is the best exercise, that's the best exercise for them. But everybody's movement strategy is completely different. And that's why I try to get through to people. Why the way one person moves is different to the way the other person moves. And it comes down to, think about what your handwriting is like. It's very specific to each person. Everybody moves in different ways. And that's just what it comes down to. It's finding the way and the problem in which they move is the key to resolving their back pain. Patty, slow runner getting back into doing long runs. 50s. Would the Pilates be beneficial to me suffering from hip and lower back pain? Not too bad. Feel I need to strengthen. Patty, it would definitely help you strengthen. And what I'm actually in the middle of designing a post-pregnancy return to running program that gets all elements of fitness involved. And so without getting too complex into this, when you run slow, you use your quads and your soleus. So your foot's on the ground and it stays on the ground for an extended period of time. Now, when you start to run faster, that foot isn't on the ground as long. So what happens is when you get to a certain speed, your automatic nervous system has to kick in. So your nervous system is being trained to move that little bit faster. Now, if you're a slow runner, you're constantly running at that one speed, and that while your muscles are being challenged, you're not getting that elastic recoil because you're not going fast enough for it to come into play. So if somebody is a slow runner and you're getting back into long runs, I hate the couch to 5K. I absolutely despise it because it only trains one part of fitness. It doesn't train your elastic system, which is like, you want to be like a spring, like a gazelle running down the road. If you don't train that, you're not protecting your joints. So what we do is we have a mixture of long, slow runs. Basically, it would be like a 5-minute run, 2-minute rest, and repeat that 3 or 4 times. So you get 20 minutes. Then you can, as you get better, you can do 4 or 5 times and it brings up to 30 or 40 minutes. But then the next session could be like a 25-second run and a 40-second rest. So you're going at a faster pace for the 25 seconds rather than the 5-minute runs. And then we cut that down again and we cut it down into a 10-second run. So you're running quite fast for the 10 seconds, but you're getting like a minute break. So what we want to see is be a nice little difference in not just your slow runs progressing that on, but getting that system challenged at different speeds, where that automatic nervous system, where the muscles have no choice but to be used in a different manner. And then figuring out what your tolerance is, how much you can tolerate of that load, and then progressing it on from there in a safe manner. And that's basically what we do. So to answer your question, yeah, the Pilates will definitely work for you, and that will get you a little bit stronger, and it'll definitely help prevent a little bit more injuries. It's not designed specifically for runners. It's just designed for day-to-day people that want to get an interest in strengthening. You don't need any equipment. The only thing you need is a chair, and then Sarah will guide you through a lot of the breathing and a lot of the exercises on it. But follow that link. There's an example for a couple of exercises on it, and it might suit you. So see what you think. Again, we're not trying to push this, guys. It's just getting the right information out there. And this course will be updated. You'll have lifetime access to it, and it'll be updated all the times. Genevieve, great to see someone encouraging exercise with back pain, not just rest and mind yourself. Rest is not rehab, Genevieve. Get out and do yourself. Get out and figure out what your body likes. Figure out what your back likes. It's a complex thing, but come away from that protective side of things. Now, from what I remember, I correct me if I'm wrong here, but I think you've 1 or 2 kids or something like that, and you had back pain before, because I remember speaking to you before, and it just come down to being a little bit stronger. That Pilates and lower limb would probably help with you, because I remember seeing your back, and your back was quite straight, and it wasn't able to bend as much. So that means the back muscles at the very, very back are really, really straight, and the front muscles don't have enough power to pull you into that flexion position. So yeah, that Pilates might suit you a little bit better rather than going to see a physio. Sarah, doing bodyweight squats is a good idea a few months after having low back pain, if they don't see any comments. Yeah, Sarah, we brought you through a 6-week program. So we strengthened up your glutes and your hamstrings to rebalance out your quads. So overall, your strategy to get a little bit better was overall strengthening. So yes, doing squats, but for every one time you do squats, you should be doing 3 exercises that's going to work on your glutes and your hamstrings. And that's key, especially if you're female, you're quad dominant. If you're doing any running or slow distance running, you need to be able to get those glutes and those hamstrings to work. The reason why females are quad dominant is because their hips are inherently wider for childbirth. So then their knees come in a little bit further. So that angle between there and there is different in a men when it's going to be like that. So this is my knee down here. That tilts in. There's my hip is a little bit wider. So just like that. Now, when that foot lands on the ground like that, and it's automatically at that angle, those glutes at the back aren't strong enough to pull it back out into that position. So what you have to figure out with females is that for every person that's going in and into the gym, and a female's doing squats, I get them doing 3 sessions on deadlifts or raised deadlifts or rack pulls or hex bar deadlifts to try and get those glutes and those hamstrings to kick in a little bit better. As an example of this, a lot of coaches will go in and they'll train females the same way as males. And this is for people who are kind of going into the gym quite an awful lot. Females are far more resilient than males. Their hormonal makeup is completely different, which means we can push them an awful lot harder than males. Now, think about it this way. If a girl comes into me and they can lift 100 kg, I can get them to lift 80 to 90% of that 4 or 5 days a week, and they'll be absolutely fine. If I got a male to do that, he'd be in a jock because he doesn't recover as well. Females recover far, far quicker. And especially at different times of the month where the hormonal makeup is going to be different. We tend to push them a little bit harder or pull back. And that makes an influence of what the best way we're trying to get out of that person or that athlete. What else we got? Ryan, is it good to do physio occasionally, even without acute pain? Ryan, there's probably no need for it. There's no need to get advice and go. There is a need to probably get a little bit of advice on mobility and stretching, but that's nothing you can't really get out of the Rethink Physio Facebook group. And even if you popped up a couple of questions in there, we're always answering questions from clients there. So it's a good idea that's a good source of information. As again, guys, we're just trying to get the right information out to people because there's an awful lot of bullshit out there. And that's the main aim of that group. So pop a couple, any questions you have, pop it into that group. Probably no need to go see a physio. Wouldn't be any harm if you're doing some hard training to go get a sports massage and help you recover. But it's all about, if you're training quite hard, recovery in between, getting your mobility and your stretches in, and then making sure that you have a nice variation in your training plan. Deirdre, degenerative disc disease, sciatica on both sides, posterior muscle spasms, in pain in both hips. 7,757 steps done today. I'm in bits. Right. That's a bit complex. Where do I start? We need an awful lot more information on that. But is it Is it the muscle spasms or is it the hips? Or is it everything together? Because it sounds like you're not working centrally in that core, and then everything is starting to work for it. So number one, if you've done 7,757 steps and your body's not conditioned to do that, and you're keeping on pushing through the pain, it's not going to end well. So especially if you're in bits just after doing that. So a lot more context is needed, and it might be good for you just to maybe have a consult with us if you're close to us or online, and we get a bit more information with you. There will be an email going out at the end of this. So for the people that didn't catch the start of it, there will be an email going out at the end of this that'll give you a chance to book in online at a discounted rate, or come into the clinic. Yeah. So we will see. Yeah, give me some more information on that, Deirdre, and I'll touch on that towards the end. But right now, let's try and get back to finishing off this topic. And see, let's get to share the screen. La 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 la. There we go, sharing the screen. No, from current slide. So running and low back pain. Let's see, am I on the right ones? No. Yes, there we go. So running and low back pain, beware. Just be cautious. As I said before, sometimes you need to run a little bit faster than for shorter distances rather than running long all the time. Yes, it's a little bit more taxing on your body. Yes, it's a little bit more taxing on the lungs, but you will feel that better after it. And generally, the shorter sessions will do you a lot better than doing a slow 20-minute run. You'd be better off doing a good warm up and then doing a couple of short interval runs that are at a higher pace. So, but it's knowing about when you start to get tired. So the best is short, sharp runs or a very, very light load and lots of rest in between. Again, you see here now, I can't fucking spell, and another spelling mistake in there, but look, it is what it is. Muscles fatigue. And when you get fatigue, you start to compensate. When you start to compensate, then you start to use muscles in different ways and joints in different ways. If you keep on compensating and keep on fatiguing in those areas, then you're going to end up pissing off a joint. And then if you piss off a joint, and then a joint might piss off a nerve, and then the nerve might piss off a ligament, various different things that come into it. But it just, people tend to kind of go, keep on going, keep on going, keep on going until they break. And that's not really a good strategy long term. Might get you through the week, might get you through the month. Otherwise, I'm going to be seeing you. Long runs, avoid it until the pain settles. Then test the water. But I wouldn't be doing the long runs all the time. I'd go out and do short runs. What we generally advise is do a 60-meter run at 50% effort. Do 4 of them, but walk back in between them. And then you do it at 60% for them and walk back in between them. Then 70%, then 75%, 80%. And you just keep going and see what your body is able to tolerate, what speed it's able to tolerate. Excuse me. And then that will give you a better introduction to running. Then we increase that to 100 meters, 200 meters, 400 meters, just depending on how bad you are, how irritable your back is, will dictate what level we're going to put you back in at. Let's get another chat, just another message there. Comments, can you tell me what content you'd like and to fill you in? All right, okay. Just going to respond to Deirdre here. How long have you had pain? How did it start? What treatment have you had in the past? And what exercises were you given to do? Sweet. Again, if your running hasn't improved over 2 to 3 weeks, go to see a physio. It's unlikely it's going to improve. So you need to, excuse me, you need to go and see somebody with that. Okay. Pop this down here. HIIT class. So Joe Wicks. Now, sorry guys, I'm going to burst your bubble here a little bit. HIIT class is classed as high intensity interval training. What Joe Wicks does is not high intensity interval training. High intensity is max effort for short periods, high intensity. That means you're going at 90 to 100% of what you're capable of doing. And then you have a long rest in between. What Joe Wicks does is he'd have a 20 or 30-second exercise. That's not going full tilt. That's only doing about 70% and having a rest. So that's what we call low intensity exercise training. The HIIT sounds more appealing, which is why it sells. But ultimately, in a scientific world, you're not going as fast as we would call high intensity. Low intensity surveying effort. Are you getting fitter after? Of course you are. Definitely getting fitter after. It's amazing to do it. But everybody thinks that going at that same 60 to 70% of each exercise class that you do is going to make a difference. It's not. You might go like at 75% and then you might go down to 50%. What we want to see is those big variations. So you're up at 90% there, like you're pushing it really, really hard for like 7 seconds. Then you have loads of rest. And then you're going for a sustained period for like maybe 40 seconds. And then you're having like maybe a 20-second rest. And then you're operating at like 70% there. So you have like 90%, 70%, 50%. That's a big jump rather than sitting in between that 55 to 75% mark. And that's when your body starts to adapt really, really quickly. Anybody that's on a weight loss program or anything else like that, if your exercise regime consists around an exercise class that you go at the same pace each time, yes, you're beginning to burn a lot of energy, but over time, your body's going to get so efficient at doing that same exercise, you're not going to lose any more weight after. So it's good to mix things up. Your body likes to be challenged. So your take-home point today, like, give your body a little bit of time, but also give it what it needs. Rest is not rehab. Take the painkillers, get out of pain, do some gentle exercises. Doing nothing, excuse me, doing nothing is not going to help it. Taking the painkillers will help it. It'll help you move a little bit freer, but then you need to strengthen up those areas to try and get that system to back and work together as one unit. Regular light exercise often helps. So I know with my low back pain, when it flares up, and it's been flaring up since January because I did something fucking stupid. But I know how to manage it very, very easily, and I can be out of pain and back in the gym without 2 or 3 days after a muscle spasm. Now, what I do with that is generally take some painkillers, let the muscle spasm settle down, get some breathing exercise to get that diaphragm to kick in, get some core exercises to try and activate those cores, and then try and work that into a different exercises where I'm flexion and bending down and standing up, but I'm also moving from side to side, and I'm also adding in a bit of a rotational component while getting in a little bit of stretching. Ultimately, what I found, and now this works for me, is just going through a gentle movement program. You can find them on the Facebook group that stretches out, that usually about maybe 4 or 5 exercises. You do them for 30 or 40 seconds, and then you take a rest, and then you do that again. But you go through it for maybe 30, you may go through it for maybe 30, 35 minutes. Feels a little bit sore at the very start, but then it begins to free up, and you kind of go, oh, geez, I feel better after that. So that's what I do. So give your body what it times need. Gentle exercise until the pain reduces. Regular light exercise does help, but you need to pick the right intensity. As I said before, if you have back pain, you're pain-free one day, don't go back in a pitch and play rugby. Or don't go back and start pulling at the garden. Ease yourself back into the training regime. You generally want to start at about maybe 50% of what you were doing at before, but you'll build it up very, very quickly. You do not lose muscle mass. If you're afraid of kind of losing muscle mass, you don't lose that much muscle mass in the first 4 to 5 weeks. If you're afraid of losing your cardiovascular fitness after you had the injuries, again, it takes 4 or 5 weeks for that to drop down, but you build it up very, very fast. If you have no fitness and then you spend 6 months building that back up, then you're off for 4 weeks because you're injured. When you go back into there, it's easier to get that fitness back than it is if you did it 6 months ago, because it's already ingrained in that system. Your nervous system is working. Like, your cardiovascular system responds far quicker than your muscles and your nervous system. So remember that. Just because you're able to run and you're not tired in your lungs, or you're not breathing heavily, does not mean that your muscles are contending with what you're putting it through. You may not have pain at that point, but then your muscles start to get achy and start to get tired, whereas you might not have had a hard session doing the training, but your muscles have taken the load, and cardiovascularly your breathing didn't get trained that much because your muscles weren't able to keep up with it. Don't do nothing. Don't do anything. 95% of cases, you do not have a damaged structure. If you want to get painkillers and you want to get advice from a GP, go to a GP. If you want exercises and you want to get those muscles loosened up and get to the bottom of it, go to a physio. Everybody has their different preferences. It's absolutely fine that you can do it. People often ask me about chiropractors. Chiropractors are excellent clinicians, but they only focus on manipulating joints. Some of the better ones have a background in strength and conditioning. They mix in some exercises with it again. But my experience with chiropractors is that they can be a quick fix. They will get you out of pain. But in general, you're probably going to need to strengthen that area again. Okay. Just coming back to Deirdre's question there. So she suffered back pain for years. 6 years, got really intense 5 weeks, completely unable to walk, had intense sessions to loosen muscles, and was told lower back muscles were like blocks. Took me about a year before I was back to walking. Ooh. I've had 2 steroid injections, 1 facet joint, no relief, complete loss of bladder control in the past 5 months. Seeing pain consultant south in Cork, South Infirmary, or here's how he's talking about surgery on a morphine patch, amitriptyline, diaphragm. All right, your lower back pain there, basically your diaphragm, your pelvic floor is not working. Go see a woman's health physio. There, that's simple. Your loss of bladder control can be down to nerve issues, but if your muscles are like blocks, the back of your muscles also work in tandem with the front of muscles. If you don't have any pain, if you don't have strength in the front of your muscles, your back is going to take the load. Think of it this way. Your bicep tightens. This tricep lengthens. Tricep tightens, bicep lengthens. If your back muscles are not getting feedback from your front muscles, they don't know what to do. So the automatic reaction is to spasm up and not to move. So what we generally will do is have a look at your breathing, have a look at what your core is actually doing. See, are those transabs starting to work? Do you have any pelvic floor control? If you don't have pelvic floor control, it's that bottom of the cylinder core strength that you need to work on to have that stable base to be able to move. If the injections didn't work, the surgery is not going to work. And if, again, with the facet joints, I think he's throwing shit against the wall there and see what's going to stick. And it's obviously he has to do something because you're in pain. He can't leave you there. But ultimately, I'd be going to a women's health physio and see what they can do to help that, number one, that bladder control, and number two, that strengthening component. That's where I'd start with you. But your 5-6 years steroid injection, you'd need about 12 weeks, about 15 sessions in my experience, depending on your frame. If you're quite tall, you're probably looking at maybe 4 to 6 months of physio. It's just the genetics of females. When they're quite tall, they're a lot difficult to rehab because their frame is a lot larger and their muscles have to be stronger. But yeah, go see a women's health physio. See if you can find a good physio and a Pilates instructor to help with, number one, breathing. Number two, getting that nervous system to settle down through meditation and breathing, and try and get those abs to kick in, trans abs to kick in. Then lastly, go see a women's health physio and try and combine all them together. But yeah, it's a difficult one. Do you want to email me, and I can probably try and recommend somebody down in Cork that could help you, or post it in the Facebook group, and I'll get back to you through that. But yeah, we can help you some way with that. Keith, thanks for dropping by. Hope you enjoyed it, and we'll move on. Any other questions, guys? Just pop it in there, and I'll get to it, because we're going to come to the questions and answer sessions now. Injuries occur due to fatigue. Simple as. If you're not strong enough to do the session that you're doing, you're going to tire out. Another joint is going to take the problem. Another muscle is going to take the load. Condition the muscles. It's number one, getting strong, able to complete the movement. It's conditioning the muscles that will keep it up there. Cause of low back pain. It's very, very simple, guys, as I explained there. You just need to figure out what your body likes. Okay. Now, anybody pop in a bit of questions can there? Lack of bowel control, Martin. A little bit more complex there. Probably not my area of expertise. There can be other issues going on there, but I would go see a specialist in male health. So there's women's health and there's male health. It depends on what part of the country you are. Martin, that we can recommend somebody for it. But wouldn't be our area of control. It's a little bit more specialized. Once we get a proper diagnosis, if you're in Dublin, okay. Let me see. Do you want to email us in again? I'm just going to pop in our email in here. If anybody has any questions in the past, here to help. Nurse Resync physiotherapy.ie. Send us an email to that email, guys, and we'll get you in touch with the right person that you need to see. We're, as I said before, we're all honest and open. We're trying to get people the right people, and not be, number one, clogging up the healthcare system, going to consultants when you have a minor pain in your back that could easily be solved with a physio. And number two, not going to any fucking cowboys. Simple as. There's a lot of cowboys out there. Same as mechanics, same as carpenters. Some people like their job, some people don't like their job. As hopefully I portrayed this evening, I really like my job. I love the clinical side of things. The clinic that I've set up here, everybody works as part of a team. We're not separate clinicians. We often do joint sessions with patients in the clinic in order to problem solve and get two sets of eyes are always better than one. And then weekly we have in services to chat through some people's issues. Sarah's excellent at women's health physio, breathing control, core and trans abs. Connor's excellent at hips. Me, I've dislocated my ankle, and I'm kind of like the low back pain specialist. We all treat all different injuries, but ultimately ankles and backs and necks tend to be my area that I stick to. Thanks so much. Definitely don't want surgery. Would love to, if you could advise me to see. Yeah, Deirdre, email me there and I'll get you sorted. Need to drop off, Connor, but thanks, Deirdre, for your time. Great insight on the back. No worries, Sarah. Yeah, that's basically it, guys. Now we do have we'll get some exercises on the video for you. I know I said I get that, but I think we're just kind of running a little bit over time here. People's beers and wine are probably just starting to run out, and I'm sure you don't want to talk to me anymore, and you want to go enjoy the rest of your evening. So I hope everybody enjoyed that. You're going to get an email this later on this evening to book in for the because you attended the webinar. You'll get the email to book in for a session if you want to see us either in the clinic or online. And we can talk you through a couple of problems. And then finally, you have if you just want to dive into the exercise, that Pilates and lower limb sessions will be there for you as well at a discounted rate. But yeah, did everybody enjoy? Give us a thumbs up. Everybody had fun. Fantastic. No worries, Martin, Deirdre. Thanks, Paddy. Great session. Excellent, guys. Great to have you all on board. Glad to see everybody. And please do join the Facebook. Thanks, Connor. Thanks, Andrea. Join the Facebook group. Have any questions with us? We're always here to help. As I said, we're here to try to guide people in the right direction, get the right information that's scientifically backed, and get you back to health. Okay, guys. Thank you very much. It's been a pleasure. And we will be doing more webinars over the next couple of months. Next month, we're going to be running one on running injuries. And yeah, join in, sign up to our mailing group, and we'll get more information out on running injuries. The website has loads and loads of information, as well as the Facebook group. And yeah, we'll hope to see you again soon. And again, please contact us in that email if you have any issues. Okay. Take care, folks. Bye-bye.
Thanks a million. Bye.
Thanks.
Thank you.